I'm going to talk about different techniques used for labiaplasty. There's a lot of different techniques that surgeons use, but the two ones that I'm going to focus on today are the wedge labiaplasty and the trim labiaplasty. So I'll go through examples where one labiaplasty technique might be beneficial over another. I have drawn 3 examples of 3 different types of labia. In this first example, first of all, the center part is the introitus, which is the opening to the vaginal canal, and these are the labia coming off of them. So this patient has asymmetric labia, meaning they don't match, the right and the left don't match. She may like this side and doesn't want to touch this side, but would like to get the left side to match a little bit better. So what you can do is employ the wedge technique, where literally we are cutting out a wedge of tissue. So I cut here and I cut here, and then all of this tissue is gone. Okay, so this is what we're left with. Now, if you use your imagination a little bit, you can see that if we sew these edges back together and draw the top portion of the labia down to the bottom portion of the labia, you are going to end up with more matching labia. Now, I am not a good artist, you guys, so you're just going to have to bear with me. It'll look more like that. In the second example, the top portion of the labia and the bottom portion of the labia are small. They're not necessarily protruding beyond the outer lips, but all of a sudden there's this flap of tissue that's just jutting out, and the patient doesn't want that flap of tissue jutting out. So again, the wedge technique would actually be a pretty good technique here, where we cut from here to here and from here to here. So all this tissue is gone, bye-bye, and all this tissue is gone. And again, you sew these 2 edges back together and you draw the tissue back together. And you are left with matching labia. Okay. This bottom patient, she has elongation of both of her labia. And you know what? She may also have a darker edge to the labia. Some patients don't like the darker edge, and not all patients have a darker edge. Everybody's different, of course. But if this patient wants to reduce the size of the labia and get rid of the darker edge and have more of a pink or a neutral edge to the labia, then the trim technique would probably best suit her. And the trim technique, you literally are just cutting from top to bottom and trimming away the tissue. So you can contour this however you like. So all of this would be gone, and all of this would be gone. And you have a new edge of labia. So this is not the native edge. There's suture going from top all the way to the bottom. And a good surgeon will make sure that that edge looks nice and natural. One technique is not better than another technique. They're just different methods of performing a labiaplasty. Ultimately, it depends on what outcome the patient is looking for, as well as what does their anatomy look like. When you put those 2 together, then you can come up with a plan for which technique serves the patient best. And that would be something, of course, that we would go over together and make sure that you are comfortable with the decision that you make at the end of the day.